Hello, this is Kelly Vita from Empowered Mama Fitness. In May, I asked Chelsea Solorzano from Graceful Therapy to come speak to us on the topic of maternal mental health. May is Mental Health Awareness Month, and I feel it is especially important to think about mental health as we talk to pregnant and postpartum mamas. Maternal mental health matters, and that's because you matter, mama. Taking care of your whole self is one of the most loving things that you can do for yourself, your baby, and your family. And if you feel like you might need help, you probably do. So, with that, we have a lot of great resources, and I will ask Chelsea to now take it over to talk to you and empower you with knowledge around all of the various perinatal mood and anxiety disorders that may arise in your pregnancy and your postpartum.
Um, this idea here down at the bottom that I highlighted is this statement that maybe you can say to yourself of, I can feel what I'm feeling and I can still choose kindness. And saying that might sound really simple, and yet it's really highlighting this idea that, hey, it's okay to feel things. You don't need to be afraid of what you're feeling. And yet, that feeling doesn't need to completely take over your life or your experience. So you can feel what you're feeling and you can still choose kindness. You can still show up in a meaningful way in your life instead of needing to push feelings down or avoid them. And that can be really freeing to be able to invest your energy in actually caring for yourself and those around you instead of investing it in trying to just avoid a feeling or make it go away. So I hope this skill is helpful and maybe something that you can start playing around with and applying in this stage of your life, but hopefully in stages to come as well. So this next piece here, we're going to start really touching on is getting a bit more to symptoms and what is maybe normal for the perinatal stage, which once again is anywhere from trying to conceive all the way to the first year postpartum. That's what perinatal means. So what's kind of a normal range of feelings or symptoms to be having versus what might be indicative of something that might be indicative of maybe postpartum anxiety or depression or OCD or something else that might benefit from some further supports or treatments. So here I have this image from this book called Good Moms Have Scary Thoughts, which is a super, super helpful resource by Karen Kleiman. I really recommend it as a quick aside. But as you can see, there's this helpful little image here that talks a bit about how a big piece of being able to tell whether or not what you're feeling is normal or maybe more concerning is the frequency, intensity, and duration of your symptoms. And if these are distressing enough to interfere with how you're living your life, because it's normal as a human, as a new parent, to feel a lot of feelings, right? And to feel like, gosh, this is a big change in your life. Sometimes that feels disorienting or overwhelming. It's exhausting sometimes to be pregnant or to care for a newborn or just to parent, right? And that can be overwhelming sometimes. Of course, you'll cry sometimes, you'll worry sometimes, right? This is all normal. And yet, if you find that these types of symptoms are really interfering with your ability to experience joy or happiness or connection, if you're having a hard time doing things you used to enjoy or enjoying your baby or seeing your partner still or feeling like this is hard but doable versus just completely impossible, then you might benefit from some more supports. And that's okay. I think it's just really helpful to name this so that then there's the possibility to do something about it because it is so common to experience variety of symptoms in the perinatal period, and yet, a lot of times people don't realize that help exists. So, next, we'll talk a little bit about some symptoms more in detail. So, This chart here is talking a bit about some common PMADs or perinatal mood and anxiety disorders versus what we like to call baby blues, which are more due to the initial transition to having a baby postpartum. So first of all, we have baby blues. And baby blues are normal and transitory. They only apply to the first 2 days to 2 weeks after giving birth. They usually peak around day 3 to 5. Symptoms might include tearfulness, mood swings, feeling easily overwhelmed, being exhausted. Feelings might be overwhelming at times, but then they pass in terms of intensity. And then in terms of distress, these symptoms, of course, might be upsetting at times, especially because they coincide with this really steep learning curve, right, of having a newborn out in the world to be getting to know, to be taken care of. But while they might be overwhelming at times, moms who are experiencing the baby blues still can feel moments of joy, happiness, and connection. And baby blues are really common. Statistics are always a little bit hard to accurately gauge, but estimates are around 80% of new moms experience some form of baby blues in the first 2 weeks postpartum. But what I want to really highlight is while these symptoms are normal, right? Once it's been 2 weeks, if you're still experiencing a lot of symptoms that are distressing to you, that are overwhelming, that are really interfering with your life, you might be getting more into this territory of some type of actual mood or anxiety disorder. So this first one here is perinatal depression, also known as postpartum depression. And that can include feelings of guilt, shame, hopelessness, a lack of a sense of connection with your baby, eating too much or too little, sleeping too much or too little, thoughts of hurting yourself or your baby, feelings of anger and irritability, and or feeling just really deeply sad. And then perinatal anxiety might look like feeling this constant sense of worry, a lot of checking behaviors, feeling like you need to check to see if your baby is breathing once you've laid them down, maybe just really worrying about all of the what ifs that might happen to your baby or to yourself, having this deep sense of dread, waking up with this deep sense of dread, having racing thoughts that are hard to control, that maybe distract you from being able to engage in a conversation with someone or enjoy your baby, the sense of restlessness, and then maybe some physical symptoms too of dizziness, hot flashes, nausea, racing pulse. These can all be symptoms of some anxiety that might be developing. Then there's also something called perinatal OCD, which includes obsessive and upsetting intrusive thoughts. And oftentimes these center around fear of harm coming to your baby, even fear of you doing something to your baby. So some really common ones can be vivid images of your baby falling down from a high space. Like if you're walking towards the stairs, you might get a really disturbing picture of you dropping or throwing your baby down the stairs. Or if you're on a balcony, you might imagine this really vivid image of your baby falling down. Other common ones might have to do with knives or fear of drowning your baby in the bathtub. But something that's really important to highlight is that these types of thoughts are really upsetting to you as the parent to be having. So you're having these intrusive thoughts flashing through your mind, but they're what we would call ego dystonic, which means they don't match with what you would want to have happen. So when you get these images, you're really alarmed and you think, oh my gosh, what is happening? Why am I having these thoughts? I must be a terrible mom or a terrible parent. I would never do this. Why am I having these thoughts? Why can't I make these thoughts go away? And then you might even be going to great lengths to avoid situations that you fear these thoughts might come to reality. So you might crawl down the stairs with your babies. I've heard of moms who like literally like will only slide down on their bottoms while holding their baby because of intrusive thoughts they've had of dropping or throwing their babies. Or you might refuse to give your baby a bath and only have your partner give your baby a bath because of these images that you're having. But I think it's really important to highlight that if you're upset by these images and you don't like them, you very likely are having this perinatal OCD intrusive thought symptom, which is not indicative of you wanting to actually hurt your baby. This is an intrusive thought that you're having that's a sign of OCD, and this is treatable. So I just want to really highlight that because there's been a lot of talk lately about postpartum psychosis, which is a very serious mental health emergency. But that is not the same as having intrusive thoughts. So later we'll talk a bit more about postpartum psychosis because it's important to be aware of, even though it's very rare. But in terms of perinatal OCD, this is actually very, very common. And most parents have at least some intrusive thoughts. But when you get into perinatal OCD territory, you're starting to have intrusive thoughts that are becoming more frequent and starting to impair your functioning and, cause you a lot of distress. Another part of perinatal OCD is compulsive repetitive actions intended to decrease fears or obsessions. I think a really common one for parents can be contamination fears, so like fears of germs. So for example, really starting to worry about their baby becoming contaminated in some way by germs, right? So they have these compulsive fears around, oh my gosh, what if my baby touched a germ, like when they touched this table here? Or what if my visitor brought in a germ or some germs on their shoes and then those germs, got on the carpet, my baby touched the carpet, like, oh my goodness. And then repetitive actions kind of come into the mix as anxiety comes up with these compulsive thoughts. And repetitive actions might look like washing your hands a lot, right? Or sanitizing repeatedly, or not letting your baby touch things ever, or really starting to limit where you go, which of course in the early newborn stage, you're more careful with germs, right? Like that makes sense. But if you notice that this is really starting to become front and center in your experiences, you might be experiencing some OCD symptoms that are centered around protecting your baby. This also can look like hypervigilance of your baby. So this might look like even though you're exhausted, you're feeling kind of overwhelmed, you're feeling anxious, you refuse to let your partner hold the baby, or you refuse to let a trusted family member or caregiver help you with the baby, even though these people would be more than capable of caring for your baby. So it's normal as a new parent to want your baby close, but at the same time, in trusting relationships, you should be able to let your baby receive help from somebody else some of the time, right? So that you can rest. But if you're finding that this is just so distressing for you to consider having somebody help you with your baby, even in little ways, you might be experiencing hypervigilance. And then this last bullet point here, fear of being alone with your baby, kind of goes back to some of these intrusive thoughts I mentioned earlier of, if you're having a lot of intrusive thoughts, you might find that you're afraid of being alone with your baby because you're afraid of these thoughts that you keep having, and you're afraid that they might somehow come to fruition. So that's another really common fear that we see with perinatal OCD. And for all of these three that I mentioned, which I know this is a lot of information, right? But for perinatal depression, for anxiety, and for OCD, these often start up a little bit after 2 weeks postpartum, but they can also spring up anywhere in the first year postpartum. So if this is happening in your early postpartum before the first 2 weeks, I would say, unless it's very distressing, keep an eye on it, right? You might be having baby blues, but if you notice these symptoms like are growing instead of getting better as you're passing the 2-week mark, then you might do well to start to just pay attention, right? Have some loved ones pay attention to see how they think that you're doing. And if it seems like these are really starting to become overwhelming and that they're taking up a lot of your mental and physical space or feel unbearable or really just interfering with your ability to enjoy your baby and be adjusting to this time of life, you might be needing some more support. And these symptoms are actually really common too. Estimates, once again, vary, but up to 1 in 7 postpartum mamas and 1 in 10 dads experience at least some form of a perinatal mood and anxiety disorder, which means that these are going far undertreated and that a lot of people have symptoms that they might not even be aware of, and they might be really struggling and really pushing themselves to just keep on without realizing that a little support could go a long way in really letting them re-engage in their life in a way that's much more life-giving and much less overwhelming and exhausting. So I share all of these things not to make the perinatal period sound scary, but more just to say, hey, these things happen sometimes. You don't need to live in fear of them. But if you think you might be experiencing these symptoms, help exists. You're not alone. And then, as I mentioned earlier, I think it's worth mentioning postpartum psychosis. This has been in the news a bit more lately. And this is a very serious mood disorder that can happen in a very small percentage of birthing people. All symptoms of perinatal mood and anxiety disorders can and should be treated. So everything we were just talking about on the previous slide can and should be treated. Those are important things to address that can really impact quality of life. But postpartum psychosis is a serious illness that's an emergency. So this is not a wait and see type of situation because it is life-threatening for the person experiencing it, as well as potentially for their baby or for other family members. So this is really, really rare. It's only about 1 to 2 out of every 1,000 deliveries. The onset is usually very sudden, typically within the first 2 weeks postpartum. And symptoms really can vary. They can include delusions or strange beliefs, hallucinations, which include seeing or hearing things that aren't here, irritability, hyperactivity, a decreased need for sleep or ability to sleep, which is different from feeling tired and having a difficult time sleeping because you're caring for a newborn. It's this like really restless energy that might look like, wow, you really haven't slept much at all. And yet people are telling you, you should really be resting. And you're like, no, I'm going to be cleaning my house right now or like reorganizing this. And like, I can do it all. I'm like on cloud 9. You might be getting into some decreased need for sleep, right? Or some grandiosity, perhaps. There also could be this paranoia or suspiciousness of people that really isn't founded in reality, rapid mood swings, difficulty communicating at times. And these symptoms can wax and wane. So they might sound somewhat obvious when they're written out, but they can be more subtle when they're actually being lived out. And I think that for this slide, this is really something that is helpful for you as a birthing person to be aware of, but it's also really helpful for people who are close to you to be aware of so that if any of these symptoms do pop up, you have loved ones in your life who can kind of be a bit of a sounding board or a mirror to be like, oh, wait, like you might think you're fine, but we're actually seeing some things that might be indicative of you needing help. And once again, this is not to be frightening, but just more in the vein of like knowledge is empowering, education is empowering, and in the very rare cases that this does come up, it's helpful information to have. These are especially things to be on the lookout for if you do have significant risk factors, which include a personal or family history of bipolar disorder or a previous psychotic episode. And I think it's really important to note that postpartum psychosis is treatable. And it's just crucial that if you are demonstrating symptoms of this, that you get emergency help so that you are able to be assessed and treated properly. And like I mentioned earlier, postpartum psychosis is not the same as having intrusive or scary thoughts that are ego dystonic, which means they don't fit with what you want to do. You're frightened or appalled by them. These are the much more common intrusive thoughts that come in OCD. So that's just a really important distinguisher to make, I think, because sometimes people who are having intrusive thoughts can be afraid to mention them because they think that they will be hospitalized or their baby will be taken away. But most of the time, what they're experiencing is OCD. So hopefully this is helpful. I put a source from Postpartum Support International on the bottom that has a lot more information about postpartum psychosis, as well as ways to get help if you or a loved one might be in this sort of situation. So that was a lot of information, I know. We're going to segue now into knowing your risk factors, barriers that might prevent care, and then we'll talk a bit about some ways you can be supporting yourself and your partner as you prepare for parenthood. So really quick, know your risk factors that you can take preventative steps to take care of yourself, and so that you can have supports in place in case you do develop symptoms. Like I mentioned, for postpartum psychosis, of course, like a previous history of bipolar disorder or psychosis would be a risk factor, as well as a personal or family history of anxiety, depression, or a past experience with PMADs. So if you've had any mental health struggles before, you might just want to be a little bit more intentional and keeping an eye out for symptoms in the perinatal period. And you might want to be a little bit more intentional too, and like building up your supports and doing preventative care just so that you're feeling well supported and coming from a good place as you're entering into this journey. Some other risk factors include stress and isolation, being a perfectionist and like liking to be able to get things done and do them well and do them all, which can look really different before having babies versus once you are adjusting to caring for another life. It can be a lot harder to meet these old standards that seemed maybe more attainable in the past. So that can be a bit anxiety inducing for some people as they adjust to parenthood. Also, if you've had sensitivity to hormonal changes in the past, like hormonal birth control, your menstrual cycle, that could slightly elevate your risk. You might be a little bit more sensitive to hormonal changes in pregnancy and postpartum. If you have a complicated pregnancy, that can, of course, come along with a lot of stressors and anxiety. So that might be a risk factor. A history of previous trauma or loss, relational stress, difficulties with breastfeeding, a NICU stay, a lot of sleep deprivation. If you have a baby who just has a harder time sleeping or being soothed, those can, of course, be stressors, right, that build up. Parenting multiples is, of course, a steeper learning curve, right, with more stressors at times. If you had a difficult labor or a difficult physical recovery, if you have a lack of support, of course, there's other things too, but all of these can just make the adjustment to postpartum feel a little bit harder. And once again, I mentioned them not to feel like I'm being a downer, right, or making things feel scary, but more as an invitation for you to be on the lookout to extra kindness or grace you might need to be showing yourself if you have any of these risk factors, because you might just need a little bit of extra TLC or support, because it's a big journey, right, having a baby. Once again, postpartum support has a ton of helpful information if you want to know more about risk factors. So there's a link there on the bottom. This next piece here is just a little bit of an overview of why it can feel so hard to get help. Because like I talked about earlier, these symptoms are actually so common, right? 1 in 7 birthing people having symptoms of a mood disorder means, like, goodness, this is all around us, right? The likelihood of somebody we know experiencing at least some of these symptoms is quite high. And yet there can still be such difficulty in knowing that you might need help, knowing that help exists, or even feeling like you can ask for help, right? Of course, there's a lot of socioeconomic barriers to this as well, which we could do a whole nother presentation on or more, right? So I just want to acknowledge that, of course. But the focus here in terms of maybe like some of the messages we might be able to address, we'll kind of hone in on a little bit. So some of the reasons it might feel so hard to get help is that we might not really know whether or not what we're feeling is normal. Maybe this is just what life with a baby is like. Maybe it's supposed to feel hard because it is hard, right? So it can be difficult sometimes to recognize if what you're feeling is more than just adjusting to life with a baby. Symptoms can be variable and unique. We also can have some really unrealistic expectations of motherhood, image, and so on that we get many different places, including on social media, even from well-meaning people around us. So we might have a hard time understanding if our symptoms are concerning. And then if they are, we might feel really guilty for that, right? We might think we just need to try harder, that we're complaining too much, that we should be able to do it all, that something's just wrong with us. We need to hide that or be ashamed of it, that we don't love our baby enough if we're struggling. We might worry about what other people would think of us. We might also feel like, well, maybe there's nothing that can be done. So even if this is a problem I'm having, I guess I just need to figure it out. Hopefully, though, what we're talking about today will help address some of these barriers to receiving help. Hopefully, you'll feel a little bit more confident in understanding when symptoms might be a concern, as well as realizing that, hey, it's possible to get help. You're not alone. Help does exist. So now we're going to move in a little bit more to things that you can be doing to be nurturing yourself and your relationship as a way to build up supports and hopefully prevent yourself from actually experiencing some type of mood or anxiety disorder. Or also, even if you are experiencing some symptoms, hopefully this can be a piece of how you care for yourself and are on your journey of hope and healing. So I think that it is important to care for yourself because, like we mentioned earlier, you matter, right? The more love that you are able to give to yourself and receive, the more love you'll be able to give to your baby. And that's such a beautiful gift to be giving to yourself, to your partner, and to your baby. And of course, to connecting as a couple is so important because that will build your sense of teamwork and support, fosters a sense of love and security and strength that will help equip you as you navigate whatever does come your way in terms of your parenthood journey. So here are a few quick ideas for caring for yourself. This first piece is really just being mindful so that you can hopefully become more aware of what you're experiencing. I think this self-compassion and kindness break that we talked about at the very beginning of our time is a really good example of being mindful. Being mindful and attuning with yourself really gives you the chance to be aware of what you're feeling and then what you might need so that you can respond instead of just reacting and feeling just pulled back and forth by life circumstances or even by your own feelings without really knowing what's going on, which can be understandably really overwhelming, right? But being more mindful can really build this sense of feeling more grounded and more equipped to navigate the many ups and downs that come with being human, right? With being a parent, with caring for another little human who has their own ups and downs. And the second piece here is soothing, which also kind of fits with the self-compassion and kindness exercise we did earlier. And this just looks like when you notice you're having feelings, right? What do you need to do in order to be kind to yourself, to soothe yourself? You soothe your baby when your baby is feeling something, right? But you can soothe yourself too. There's so many different examples of soothing, but be really simple, taking some deep breaths. There's so many great apps out there that can give prompts for breathing. If you're interested in that, you can practice self-compassion like we talked about earlier. You could listen to music that you like. You could engage your five senses by noticing things around you just to kind of pause a little bit. You can be creative and really figure out what works for you. And remember that even a little bit can go a long way. I know that when having little ones, especially newborns, it can be hard, of course, to do some big grand thing, but you don't need to wait for a big grand moment to soothe yourself. You can find little things that fit in your everyday life. And then this third piece here is resting. I think that time and time again, experts have found that one of the best things you can do for your physical and emotional well-being is try to get some rest, which once again, I know is easier said than done with a newborn, right? But trying to find at least 3 to 4 hour stretch of time where you can be getting uninterrupted sleep is a huge safeguard in terms of your emotional health, your mental health. It will also make a difference in terms of how you feel physically, in how able you are to connect with your partner, all these things. And I realize that this will likely mean that you will need somebody to help you. So it might be taking a shift with your partner, even if it's maybe not the times that you used to be sleeping before baby, just really trying to find some way to find this uninterrupted stretch of sleep can go a long way. So this would be one of the first things I would say to try if you do notice that you're feeling more anxious or more depressed, is really see if getting a night or two of better sleep, or by night, I mean that stretch of a few hours, pay attention to how you feel after that. And it may be that a lot of your symptoms are being triggered by a lack of rest. So I think that's hopefully helpful to highlight. Once again, I know it's easier said than done, but hopefully you can talk with some of the supports in your life about how you might be able to really prioritize this rest, especially in the first few weeks and months. And this next slide here talks about connecting as a couple, really getting to this piece of nurturing your relationship, because I think we are inherently such relational beings, and how we feel in relationship with the people closest to us can really impact how we feel as individuals. It can also really impact, of course, like how we feel as a parent, right? So I think that while it can be easy to kind of let your couple relationship go to the back burner, and of course, like the relationship needs to adjust, right? To having a baby, things will look different. I think it's still really important to try to be fostering connection, even in small ways. So these are a few really simple little tidbits. So the first piece is listen to and look at one another. In this really this busy time, right, of having a baby, it can be hard to do something as simple as like even gaze at each other for a few minutes, even a few seconds, right? Like look your partner in the eye a couple of times throughout the day instead of just talking while always doing a task. That can go a long way amidst daily chaos. This next piece, reach for each other instead of turning away. By this, I mean, instead of just being caught up in all of the busyness and kind of pushing one another away, just trying to do things alone, try to look for really small moments that you can be connecting. This can go a long way in terms of helping each other feel seen and cared for. So this could be as simple as sharing, like, gosh, I'm feeling really tired right now. I need a hug, or I need a minute, right? Like just being able to acknowledge what you're feeling and ask for something kind of gives your partner a glimpse into your experience instead of you just saying something snippy or going off and slamming the door or something like that. So obviously I realize these won't be big, grand moments of connection or big, grand conversations in these early days. I'm more just saying be intentional in small ways that you can be naming your experience and kind of connecting with your partner in that way. This can really build teamwork then too, because if you're voicing what you're each experiencing, turning towards one another in that way, you can work together as a team to problem solve some of the practical issues. It might be that your partner is able to give the baby a bottle while you just sit down for a minute, or change a diaper, right? Or take a little quick rest. There's many different things that you might be able to figure out together, especially if you're able to respond to one another's like bids for connection in that way. And then this last one here is enjoy each other in small ways. Once again, doesn't have to be anything grand, but finding even a few small ways to connect each day can go a long way. So it might be enjoying your baby for a couple minutes together and leaving the dishes undone for a little bit, right? Might be laughing at something really small, a funny meme that you found, a few minutes of one of your favorite shows, getting to just sit together on the couch for a moment after you've put your baby down. Just these little things, just be on the lookout for things that can spark joy, even in the midst of all that's going on, right? So hopefully these are helpful and maybe feel a little bit doable, even amidst all of these normal life things that will be happening. But like I said, nurturing yourself and your couple relationship can really go a long way. So I hope these might give you a few ideas to use towards that end. This next piece here is just a brief overview of treatment options for perinatal mood and anxiety disorders. So once again, just really want to highlight, if you think you have a PMAD, you can get help and feel like yourself again. So please err on the side of caution, reach out for help. The worst thing that you can do is get some extra support and learn a few things about yourself, even if you don't have a full-blown PMADs. I would say, yeah, erring on the side of caution, getting a little extra support is never a bad thing. So anyway, just want to encourage you once again, you're not alone, and help does certainly exist. And help might look like any combination of the following. And I think it usually does look like a combination of things because we're complex people, right? And as much as we might wish there's just one simple cure-all, life usually isn't that way, right? So it's helpful, I think, to find a combination of supports that work for you and your specific situation. So 4 broad categories here might look like self-care, and being intentional about sleep and rest, getting good nutrition, finding help from others that you trust with your baby or with your other kids, having time with your partner or your friends that you enjoy, being mindful, doing nurturing exercise and movement such as yoga that Kelly knows so much about, of course. Just these things that can be taking care of you as a whole person, which as an aside are obviously helpful to be doing anytime, right? Not only if you think you have a PMAD, but these are just like general well-being things that are really helpful. This next category here is social support. So really asking for and receiving help from others is so important, I think, once again, as being human, but especially in this perinatal period. This might also look a little bit more honed in on the perinatal experience in particular and even symptoms. So talking with others who are going through a similar experience, being with friends you already have, with parent groups, with people in maybe a faith community or some other setting like that could be helpful. It might also include peer support groups. I know that usually hospitals have peer support groups. There's ones in the community, Postpartum Support International, once again, is a great resource. They have a lot of groups as well. And that can be really helpful. These vary from just groups that focus on just the experience of becoming a parent. Some might be more focused in on specific mood symptoms that you might be experiencing. There are also some for loss or for parenting multiples. Like there are many different options that are out there. So that can be a really powerful thing, I think, to get to share your story, but then to also hear other stories from people. Just such a beautiful way to learn from one another. And once again, to remind one another that, hey, none of us are alone. We can get through this together. Then, of course, there's also professional help. So talking with a licensed therapist. As I mentioned at the start of my presentation, I'm certified in perinatal mental health. That's called being a PMHC. So that can be a really helpful thing to be on the lookout for if you are looking for a therapist. Postpartum Support International has a whole therapist directory where providers who have specialized training can list their practice so that they're easier to find. I think that any type of help can be a good support. Therapists do good work, but in this time of life, it can be helpful to have somebody who has at least some working knowledge of the perinatal period, because this is such a unique time of life, and they might be able to better support some of the unique needs that you have in this season. And then this last piece here is medication, which can sound a bit scary, I know, and can have a bit of a stigma. But to be honest, it can really be a helpful part of treatment for some mood symptoms. And I think can really help people have more space to work through some things in their life that they might otherwise be having a bit of time working through. So that can just be a really great resource. I know that especially people who are pregnant or breastfeeding can be a bit reticent to be on medication. And I would just encourage you that if you fall in this category, it can be really helpful to talk to a professional who specializes in treating women in the perinatal period. So once again, there are providers who are trained in this period. There are psychiatrists, there are other OBGYNs who can prescribe, who are more aware of what needs might look like during this period and who have good information. There's also good information that exists in terms of safety data for medication. So that can be a helpful resource too. I think those are listed also on PSI's website. And I think it's also just worth throwing out that there are pros and cons to taking medication, but also to not taking medication. So this kind of goes back to this piece of suffering. If you are experiencing symptoms, it comes with a cost too, right, to you and your family. So I just really encourage you, once again, if you are experiencing any symptoms, reach out and get help, whatever combination of these supports that it might look like for you, because there is definitely hope. There is definitely ways to get support. And then here at the end, I've listed a few resources. The first one I've put here is Postpartum Support International, also known as PSI. They're just a really great resource. Their website has so many different resources, including, like I mentioned, that therapist directory, support groups. They have a lot of written resources that they themselves have kind of condensed down a lot of information in the field that's a little bit easier to read. They also have a lot of books and websites listed. They have state chapters. So basically, there's so many things there. They also have a warm line and a hotline that you can call into if you or a loved one are experiencing symptoms. So I could have listed so many resources on this page, but because of PSI, I thought I would consolidate things a bit and just give you that lovely resource that hopefully you can have in your mind, tab it for the future. They have so many wonderful things on there. And then just a couple of resources that I think can be really helpful in terms of written resources. Good Moms Have Scary Thoughts. I mentioned them earlier. This is a really great book that has a lot of information in a really approachable way. There's drawings throughout. And so I would just highly recommend that. That can be really helpful. And Baby Makes Three is a book specifically for couples. It's by the Gottmans, who are well-known couple researchers. They have just some tips for connecting as a couple, building your relationship as you adjust to having this new little one and are really building your family and preparing for moving forward. Becoming Us is another book that really focuses on building relationships as a couple and then as a whole family. This is more from the perspective of emotionally focused therapy, which is a really lovely attachment-based model that is just focused on building healthy relationships across the lifespan. So that can also be another helpful resource for couples. And then this last one here, the Pregnancy and Postpartum Anxiety Workbook, is just a great workbook that you can work through yourself if you're the type of person who enjoys having some specific skills to work on or some things to write down. There's prompts throughout, as well as some psychoeducation. So that can be a great resource too, if you're wanting to learn more or even work through some symptoms on your own. So I hope that this has been helpful. I also have included some questions and discussion for you to be reflecting on, maybe talking through with your partner or with other trusted people in your life. I think, once again, just so that you feel less alone, that you feel more equipped and prepared to know how to take care of yourself and your relationship as you are moving on in this journey. And then lastly, this is some information about the practice that I work at, Graceful Therapy. We have a lot of wonderful therapists here, a lot of different modalities that we practice. Like I said, I specialize in perinatal mental health, and there's 2 or 3 other therapists there who specialize in that as well. And there's therapists who also take perinatal clients, even if they aren't fully certified yet. We have a lot of great supervision there. So rest assured that many of the therapists there might be able to support you in this journey. So feel free to reach out. You're also welcome to reach out if you need any help connecting to other resources. I'm always happy to be a resource in the community and to kind of be a bridge builder. Because I know sometimes it can be so hard when you feel ready to ask for help, but then feel overwhelmed by all of the options that might be out there. So I'm happy to kind of be a friendly face that you've at least seen once before who can maybe give you some ideas about supports that might exist in your area. So thank you so much for your time. And Kelly, I know that you were about to say something there.
Yeah, no, thank you so much, Chelsea. I feel like I've related to a lot of what you've talked about. So thank you for that. And I just wanted to point out here that you're not necessarily all in person. You do offer virtual counseling as well, right? So even if they're not in the Oswego or Aurora area, but really have connected with you, they can still reach out, and it could be done in a virtual basis.
Yeah, thank you so much for highlighting that. I completely forgot that really important piece. I think that since the pandemic, there's really been this opening up of virtual options for support. So there are so many therapists who offer telehealth. There are also so many peer support groups that are offered via telehealth, which I know there's something special about meeting in person, but I think especially in this life stage of having a newborn or being very pregnant, it can feel really hard, right, to get out the door or to get childcare. And so being able to just have this window of time where you don't have to commute or don't have to, figure out as many logistics can be really, really helpful. And a lot of therapists and groups are very welcome too, to if you need your baby to be with you during meetings, or even if you need to breastfeed, right, you can just turn your camera off or adjust the screen a little bit if you don't feel comfortable. Like those are just, I think, such wonderful options to have that just make things a lot more flexible. So thank you, Kelly, for bringing up that important piece.
Yeah, and also just wanted to make sure that we cover that this is not just for mamas, right? This is for her partner as well.
Absolutely. Yeah. So I know we touched a little bit, right, on strengthening the couple relationship and how that's important. But yeah, dads are so important too. And could do a whole nother talk on that, right? I could ramble on about these things for hours and hours and hours. But yes, Kelly, thank you for highlighting that. Dads are so important too. And while unfortunately there are not as many support groups for men, um, as there are for women right now. There are some, and PSI has some that they host. They also have some resources listed on their website for partners, for dads, if you are in a heterosexual relationship. So I think that's really helpful to highlight too. And I really hope that this is an area that will continue to grow in the future so that there will be more options for male identifying partners to get support as well. Because yeah, you dads matter too, right? And make such a big difference for the whole family. So yes, if you feel like you want to come in as a couple, I will say too, like a lot of my work entails working with couples. Sometimes I find that men feel a little bit more comfortable coming in with their female partner. So that can be kind of helpful if it feels daunting, maybe to go to individual therapy if you are a male partner. Although, of course, I mean, I'm biased, I'm a therapist, right? But I think everybody can benefit from therapy. But yeah, there are support groups as well, or peer groups. So there are resources for dads out there too. And I think that dads, one of the most loving things you can do for yourself, right, is to take care of yourself. Also, one of the most loving things you can do for your partner is take care of yourself, because likely your partner will be very focused on needing to take care of the baby and on her own recovery. And there's so many pieces that go into that. But it can be hard for her to then also take care of you, right? Even if she wants you to be well and wants you to be supported. So by you taking care of yourself as the father, you are actually giving a lovely gift to your partner, for the mama, right? And for your whole family. So yeah, both parents matter, right?
Absolutely. Very cool. All right. Well, I think that's everything that I wanted to call out. So thank you again, Chelsea. It's been an absolute pleasure having you on, and you shared so much great information, but also great resources that we can turn to after the fact.